What is bone cancer? Bone cancer is a rare type of cancer that starts in the cells of the bones. It can affect any bone in the body, but it most commonly develops in the long bones of the arms and legs. Bone cancer can be either primary, originating in the bone, or secondary, metastatic, spreading to the bone from another part of the body. Primary bone cancers are less common than secondary bone cancers. Types of bone cancer. 1. Osteosarcoma. Most common type of primary bone cancer. Typically affects the ends of long bones, such as the femur, thigh bone, or tibia, shin bone, or around the knee. Common in teenagers and young adults. 2. Ewing sarcoma. Affects bones or the soft tissue surrounding bones. Most often occurs in children and young adults, particularly in the pelvis, legs, and ribs. 3. Chondrosarcoma. Develops in cartilage cells and is more common in older adults. Typically affects the pelvis, ribs, and proximal parts of long bones. 4. Chordoma. Rare cancer that occurs in the base of the skull or spine. More common in adults over 30. 5. Other rare types. Fibrosarcoma and malignant fibrous histiocytoma. Often affects soft tissues around bones. Giant cell tumor of bone. Usually benign, but can occasionally be malignant. Causes and risk factors. The exact cause of most bone cancers is unknown, but some factors can increase the risk. 1. Genetic factors. Inherited conditions such as Li-Fraumeni syndrome, hereditary retinoblastoma, or Paget's disease of the bone. 2. Previous radiation therapy. High doses of radiation can increase the risk of developing bone cancer. 3. Bone diseases. Chronic bone diseases, such as Paget's disease, may increase risk in older adults. 4. Age and growth spurts. Osteosarcoma is more common in teenagers during rapid growth spurts. 5. Family history. A family history of bone cancer or genetic syndromes can increase susceptibility. Symptoms of bone cancer. Symptoms of bone cancer can vary depending on the location and size of the tumor, but common signs include 1. Bone pain. Persistent or worsening pain, often worse at night or during activity. 2. Swelling and tenderness. Swelling near the affected bone or joint. 3. Fractures. Weak bones may break more easily. 4. Limited movement. Difficulty moving a joint near the tumor. 5. Other general symptoms. Fatigue. Unintended weight loss. Fever or night sweats, less common. Diagnosis of bone cancer. To confirm a diagnosis, a doctor will use a combination of clinical evaluations and diagnostic tests. 1. Medical history and physical examination. Assessment of symptoms and family history. 2. Imaging tests. X-rays. Identify abnormal growths or fractures. MRI and CT scans provide detailed images of the bone and surrounding tissues. Bone scan. Detects areas of rapid bone activity. 3. Biopsy. Needle biopsy. A sample is taken using a thin needle. Surgical biopsy. A larger tissue sample is obtained surgically. Biopsy confirms the cancer type and grade. 4. Blood tests. Certain bone cancers may cause elevated levels of alkaline phosphatase or lactate dehydrogenase, LDH. Stages of bone cancer. Bone cancer is staged based on tumor size, spread, and grade. 1. Stage I. Low-grade cancer confined to the bone. 2. Stage II. High-grade cancer confined to the bone. 3. Stage III. Cancer is present in multiple locations within the same bone. 4. Stage IV. Cancer has spread, metastasized, to other parts of the body, such as the lungs or other bones. Treatment of bone cancer. Treatment depends on the type, stage, and location of the cancer, as well as the patient's overall health. 1. Surgery. Primary treatment for bone cancer. May involve removing the tumor along with a margin of healthy tissue. Limb-sparing surgery aims to preserve the affected limb. In severe cases, amputation may be necessary. 2. Chemotherapy. Often used for high-grade cancers like osteosarcoma or Ewing sarcoma. Drugs like doxorubicin, cisplatin, and ifosfamide are commonly used. 3. Radiation therapy. High-energy beams target and kill cancer cells. often used for cancers like Ewing sarcoma or in cases where surgery is not possible. 4. Targeted therapy. Drugs designed to target specific mutations or pathways in cancer cells. Example, denosumab for giant cell tumors of the bone. 5. Clinical trials. Experimental treatments, such as immunotherapy, may be available through clinical trials. Prognosis of bone cancer. The prognosis depends on several factors, including the type of cancer, stage at diagnosis, and response to treatment. 1. Localized cancer. High survival rates with prompt treatment, e.g., 70 to 80% for localized osteosarcoma or Ewing sarcoma. 2. Metastatic cancer. Prognosis is less favorable if the cancer has spread, particularly to the lungs or other organs. 3. Early detection. Early diagnosis and advances in treatment have improved survival rates. Coping and support. Dealing with bone cancer can be physically and emotionally challenging. Support options include rehabilitation, physical therapy to regain mobility after surgery, support groups, connecting with others who have similar experiences, psychological counseling, coping with the emotional impact of cancer diagnosis and treatment. Bone cancer is a rare but serious condition. Early diagnosis and personalized treatment plans are critical for the best outcomes.